Good afternoon, once more, members. My name is Elizabeth Mugi. Wish to invite our presenter, Mariam Ali, to take us through. So welcome, Mariam, and have a good presentation.
Our topic today is on nursing practice in perioperative nursing. And our objectives are we will define perioperative care. Then we'll get to define who the perioperative nurse is, the role of the perioperative nurse. Then we'll look at the common errors during perioperative practice and the mitigation of these errors. So what is perioperative care? This is the care that is given before and after surgery. And this period constitutes the surgical experience of the patient. Perioperative care usually takes place in hospitals, in surgical centers attached to hospitals, in freestanding surgical centers, and in healthcare providers' offices. We can as well define perioperative care as the nursing language which describes the nursing process in perioperative setting by utilizing these four domains. Safety. We also have the safety of the patient, also the safety of the physiological responses of the patient, behavioral responses, and this one is with the patient and the family. and the health system. So the perioperative care has 3 phases. We have the pre-operative phase, and this is defined as the time period from the time decision for surgery is made up till the time the patient is transferred into the OR, operating room for surgery. And we have the inter-operative phase, the period from which the patient is transferred into the OR up to admission into PACU, and that is the post-anesthesia care unit. Then we have the post-operative phase. This one begins with the admission into PACU, that's the post-anesthesia care unit, and usually ends when the patient is taken back to the ward or patient is discharged to the clinic or at home. So those are the 3 phases that encompass the perioperative care. So who provides this perioperative care? This one is perioperative care is provided by the perioperative nurse. So who is this nurse, the perioperative nurse? How do you define the perioperative nurse? She is a registered nurse who specializes in perioperative nursing practice. And she performs activities in the pre-operative phase. That is the phase from patient admission up to the point the patient is received in the OR. The inter-operative phase, from the point the patient is transferred to the OR up to transfer to PACU, and the post-operative phases, which is PACU and also the ward. And as definition up there, it is the registered nurse specializing in perioperative nursing practice, performing nursing activities in the pre-operative, intra-operative, and post-operative phases of the patient's surgical experience. The nurse provides care for patients in the period prior to right after surgery. Based on standards and recommended practice for perioperative nursing, the perioperative nurse also provides continuity of care throughout this period using scientific and behavioral practices, and with the goal of actually meeting the patient's need, the patient who is undergoing a surgical intervention. So you mark those words, they use scientific and behavioral practices in order to deliver their care. The process is dynamic and continuous and requires constant reevaluation of the nurse, reevaluation of the patient throughout this period, and the nurse evaluates her practice or her care of the patient in the OR, operating room. The same perioperative nurse is responsible and accountable for the major nursing activities occurring in the surgical suite. So what are the goals of the perioperative nurse? Basically, the goal of the perioperative nurse first is to provide safe care, okay, supportive and comprehensive care. And during this care of perioperative care by the perioperative nurse, she uses the nursing process to provide care. And I think last week you had a session on nursing process, and those who attended are conversant with it. Her other goal is to assist the surgeon and also function effectively as a member of the surgical team. While conducting her activities in the OR, she practices among a team of a group of medical people, that is the surgeon, the anesthetist, and others, in order to provide her care to the patient. So she practices among team members. Third, her goal is to create and maintain an aseptic and sterile environment during her practice. So for her to be able to deliver all these activities or to carry on her practice, she requires the following core nursing skills. She requires 1, critical thinking skills. She needs to think and act effectively at every instant during the surgical experience. 2, she is required to provide patient safety, very important. Patient safety is very important during this perioperative care. She is required to deliver patient and family education, and this mostly is done during the pre-operative phase when the patient is admitted, and also the pre-operative phase and the post-operative phase. And this is specific to the type of the surgeries the patient is going through. She's supposed to be able to care for diverse patient populations. This includes pediatric patients and geriatric patients. She has to be knowledgeable on ethical and legal guidelines that are related to her day-to-day activity. She has to be conversant while she is carrying on her practice. The perioperative nurse has to be able to fit in a team and also coordinate multidisciplinary teams, because there is no time she will work in isolation. She'll always be working with a team, maybe operating or doing other procedures in the operating room, in the ward setup, or in a clinical setup. She is required to be knowledgeable, as one of the requirements, of anatomy and physiology of different parts of the body. And then she is supposed to carry out evidence-based practice, and this requires her to conduct surveys and research during her practice. So what are the roles of the perioperative nurse? The perioperative nurse during preoperative period, what are activities? The perioperative nurse has different roles. She has roles in the preoperative period, in the inter-operative period, and in the post-operative period. And we have also defined the preoperative period from the time of admission to the time the patient is wheeled into the operating room. So the preoperative phase, the first phase could be in the clinic setup or in the ward setup, and the other setup could be from the time the patient is received in the OR to the time the patient is transferred on the operating table. So these are some of the activities that is expected from the perioperative nurse. One is assessment of the client, business evaluation of the patient the day before surgery. At this point, she's also to identify any potential and actual health problems of the patient. Pre-admission testing, the tests that have been requested by the surgeon, she is supposed to confirm that they have been done. And she is also involved in the preoperative teaching involving client and support persons. She is also supposed to provide psychological support, which is very important for the patient's surgical outcome. So she is supposed to allay patients' anxieties, not only the patients, even the significant others. She is supposed to provide patterns of coping and establish trust relationship between the patient and the significant others, the other team members. She is also supposed to explain routine procedures that are supposed to be carried out. Also encourage verbalization from the patient. Encourage the patient to verbalize out the fears, ask questions, okay, and make the environment a discursive environment. She's supposed to demonstrate confidence in the patient, to demonstrate confidence in the surgeon and the staffs that are going to take care of the patient. And if possible, she is supposed to provide spiritual care where appropriate. Let me go back. To add on the preoperative care, as I mentioned earlier, it is carried out in the ward. There are two aspects of preoperative care. The perioperative nurse who is in the theater is also supposed to contribute to the preoperative care, even if the nurse is stationed in the OR. And this actually depends on the setup of the organization. In some of organizations, the nurse in the ward is it's a different team from the nurse in theater. So when this is so, it is recommended, and it's the ideal practice, that the operative team, the operating team in the operating room, the nurse should endeavor to, the day prior to surgery, pay a visit to the patient, okay? The patient who is supposed to come for surgery the next day. Why is this so? Very important in allaying the patient's fears, because most of the time when these patients come to theater, they find people in masks and capes and in attires that they are not familiar with. So this actually causes the patient, adds to the patient's fears and anxious. And in the operating, they do not know anyone. So it's best practice that the nurse who is supposed to scrub for this patient the next day to visit the patients who are supposed to come to the OR on the previous day, introduce themselves, create rapport, and actually inform the patient that she will be in the team. And if not, ensure that she goes with one of the staffs who will be in the theater the next day. And this one helps in the patient relaxing and also helps in the patient outcome. This is best practice, especially where the resource is enough and there's no resource deficit in those institutions. Very much recommended. So the inter-operative phase, what is the role of the perioperative nurse inter-operatively? Here, the nurse encompasses a variety of specialty roles. The nurse can be a receiving area nurse. She takes care of the holding bay. She could be a circulating nurse. She could be an anesthetic nurse, and she could be a scrub nurse, instrument nurse, a PACU nurse, that is recovery room nurse. All through these roles, she is functioning as the patient's advocate. So we will look briefly at what the role of each individual nurse. So the holding bay nurse, the receiving area nurse. What are her responsibilities while in receiving area? One, she's supposed to prepare her environment with all the equipment and supplies required for her day-to-day activities. Secondly, she is the one responsible to receive a patient from the ward nurse. So once the ward nurse arrives to the OR, the first contact with the patient in the operating room is the receiving area nurse. So this nurse has to confirm identity of the patient. How does she confirm the identity of the patient? She has to ensure that the patient has the tag, and she is supposed to call out the patient by the names. And how many names? 3 names. In confirmation of identity, the patient has to have a unique number, and this number is the inpatient number. She has to ensure that all the required documentation for the patient are availed. This includes the patient file, and it has to be documented and up to date. There is a checklist, the patient's cardex, and also the informed consent. Informed consent is very vital. So she has to confirm all the documentation required for this specific surgery are availed. Thirdly, she has to ensure there's availability of blood works. These are the results of all the blood investigations done and also radiological examinations that have been requested from. She is also to ensure that the patient has tabbed nil per oral for the particular surgery, and she has to confirm with the patient. And also she has to confirm that all prescribed requirements for surgery are available. That is the X-rays, any blood products, if there any blood that is required, blood transfusion required for the patient, any prosthesis and any medication that has been requested for by the doctor or the surgeon. If satisfied, the receiving area nurse is satisfied with everything, the receiving area nurse will transfer the patient across the barrier. The barrier is specific to some institutions. Some institutions will not have a barrier, but before you receive a patient for surgery, ensure you have confirmed all this and counter-checked with the ward nurse that all that is required for the patient is available. So during this, at the holding bay, the patient is under the custodian of the receiving area nurse, who takes over the role and actually allays anxiety of the patient and if the family is around, develops rapport with the patient, and when the operating room is ready, will assist in wheeling the patient to the operating room. This is the first stop of the patient, and this is where the patient gets all the required care before the patient comes into the OR. And if there's anything that goes wrong at this part of the receiving of the patient, it will be taken across through all the process, the intra and the post. So the receiving area nurse is a very instrumental nurse, very important, and activities are very vital. So we go to the anesthetic nurse. Anesthetic nurse, her role as an anesthetic nurse is to ensure client safety in the OR. The anesthetic nurse role is to prepare the operating room, ensure it is clean, temperatures, the required temperatures are set, and humidity is also set. They are supposed to ensure that all the necessary equipment and supplies are available, especially the ones that need to be used by the anesthetist. They also have to check on electrical equipment, whether all equipment are functioning. Their role also is to assist in transferring the patient from the OR table, and they also assist in positioning of the patient. They are supposed to assist the anesthetist during anesthesia induction, maintenance, and reversal. And this is a very important role. They always have to be there during this process of induction, during maintenance and reversal. Their presence is very vital. They should ensure patient safety during positioning, okay? And during positioning, they are supposed to be able to protect the nerves, circulation, and skin integrity. While positioning the patients, they are usually under anesthesia and they're put in position that in normal circumstances, they would not position themselves. And sometimes it stretches the nerves and the muscles. Therefore, you need to protect these patients during this time, ensuring you don't overstretch the areas. And the skin integrity, you need to pad the prominences. They need to be padded. This activity is very important. Most of the time, it is overlooked in our institutions. It is taken for granted, but padding of the prominences of the patient should be done. And after surgery, the anesthetic nurse will assist the anesthetist to wheel the patient to the post-anesthesia care unit. Her role, the perioperative nurse's role is a circulating nurse, also known as a circulator, and she is a very important person in the surgical team. Why is she important? Because she's the only non-scrubbed member of the surgical team besides the anesthesia team. The anesthesia team, mind you, are only concerned with the issue of anesthesia, and that is the airway of the patient. So the circulating nurse cuts across, and her activities are very important. Why? It is because she represents the coordinating link between the scrub team and all other personnel, okay, and also other departments associated with the surgical patient and the procedure. She is responsible for managing patient care activities in the operating suite. Therefore, her duties start way long before the patient arrives in the operating room, because at this point, she'll also assist in the preparation of the environment, the machine, the equipment, and the instruments that are required for that surgery. And her roles will also continue until the patient is wheeled to the PACU unit. Okay. She is also responsible for keeping the records in the operating room. What are these records? She's supposed to document the swab count, instrument count, sharp count. She's also supposed to document all the activities that are taking place in the operating suite. Finally, if there are any specimens she's required to take care of the specimen, receive the specimen from the scrub team, preserve it in the recommended solution, label, and ensure there's also a request form filled for the same. So her responsibility also goes to taking care of the specimen. As a link between operating room and surroundings, she also coordinates, oversees, and is involved in a total nursing care of the patient in the OR. She supervises in transporting, positioning, moving, and lifting of the patient. She can also assist in anesthesia, and above all, she also performs a surgical skin prep. And this surgical skin prep it depends according to different institutions. In some institutions, it is the surgeon who performs the surgical skin prep, but in some institutions, it is the circulating nurse who performs the surgical skin prep. She maintains accurate documentation of all the activities, maintains a septic and safe environment. How does she maintain a septic safe environment? In case in the operating room, there are students, she ensures that the distance between the distance between the operating team and the students is enough to prevent a cross-infection, and also ensures that the doors are kept closed, the operating room doors are kept closed, and she keeps on reminding the team about the safety of the patient in relation to infection control. She ensures the surgical team maintains sterile technique and a sterile field. Continue. She communicates special post-operative needs to appropriate persons at the completion of this case. Yeah, any incidents that have occurred in the OR, she will document in the Cardex and communicate the same to the PACU team. And lastly, preserves and labels specimen. So her Her role as the scrub nurse. The perioperative nurse performs another essential role in the operating room, and this is as a scrub nurse. Her expertise includes, and that is why she's able to perform as a scrub nurse, knowledge of anatomy and physiology and the procedure to be performed. Therefore, she has the ability to recognize the instruments used in a particular surgery. She has critical thinking skills, and this helps her to gather specialty items that are needed in the procedure and also gather items during an emergency. And her main responsibility during as a scrub nurse is maintenance of the sterile field during surgery, both with her instruments and both with the surrounding. So what is the actual assist of the scrub nurse? She actually assembles the required instruments and supplies in a manner that will maximize safety of the patient and efficiency. What do I mean by safety? Using aseptic technique. Ensures all her instruments are sterile, and while she's laying them down, she ensures that she maximizes on asepsis. And she also maximizes efficiency while doing the same. So her role basically requires in-depth knowledge of each step of the surgical procedure. So there's a perioperative nurse at all times when she's assisting, she is supposed to know step by step and anticipate the surgeon's needs. So her knowledge on this allows her to anticipate each step of the surgical procedure, and she also has the ability to give the instrument as anticipated when needed. So when there is a bleeder, she automatically does not wait for the surgeon to ask for a cautery or an artery forceps. She automatically hands over to the surgeon. It is said the surgeon is to remain silent. The nurse is only to hand over the instrument because she knows the anatomy and physiology and knows what is expected because she is conversant with the step-to-step procedure of the surgery. What are other roles as a scrub nurse? She performs other actions as appropriate. She acts as acts as a client advocate, provides privacy, and actually protects the patient from harm. She follows established procedures and protocols, documents all OR care, and she helps coordinate health team activities. She promotes ethical behavior that is respect and confidentiality. And this is important because most of the time you realize when patients come into the operating room, they are usually not dressed, they're actually naked. So whatever you see, you leave it in the operating room. And it is prudent enough not to discuss patients while they are on the table. During her assistance during surgery, she's also able to monitor blood, fluid, and other drainage output. And also, she's also able to maintain quiet, relaxing atmosphere because it is said that the client can also hear. Actually, she is able to control whatever is happening in the OR for the benefit of the patient. As you see, she is the patient's advocate. PACU care also can function in the post-anesthesia care unit. What are her roles in the post-anesthesia care unit? Here she reviews information and does her baseline assessment upon patient admission in the unit. Once the patient is in the unit, she assesses airway, actually the vital signs, respiration, cardiovascular function, She also assesses the surgical site and also the function of the central nervous system, whether the patient is conscious or not, the level of consciousness of the patient. She also takes care of the IVs and all the drainage tubes, records the amount that is draining, and also maintains input and output chart. The vital signs and the patient status are reviewed every 15 minutes or when required. And she also documents all her activities in this unit. And when handing over to the ward nurse or discharging the patient, she provides report and transfers the patient to the particular units. So the perioperative nurse also functions as a charge nurse. Who is the charge nurse? What are her roles? She's the overall in charge of the theaters. In some institutions, you have more than one operating room, but in all operating rooms, there's always a team member, a team leader, sorry, a leader. And this leader is also referred to as the charge nurse. What is the role of the charge nurse? The primary goal of the OR is coordination, very important because it is not a one-man show, it is a team factor. So she ensures that there's coordination, and the coordination is prompt. The coordination is done to ensure prompt, safe, and effective care of the surgical patients. And this is the central goal of the operating room charge nurse. So she ensures that patients, staffs, and all equipment are put together so as to be able to accomplish the goal of operating on the patient. She is also involved in staff education and competency testing. She is also involved in administrative duties such as budgeting. She also schedules patients in specific operating rooms, and this depends on the institution if they have more than one operating room. Ensures all the patients who need to come for the day's surgery, they're available, and the surgeons are also available to perform the particular surgery. So basically, she ensures all the required items, the required personnel, the required equipment are ready and are available for the function of the operating room. She also provides advice and guidance to the other team members. So to summarize on the perioperative nursing focus, basically, one is to provide safe environment, and that is universal protocol, using the universal protocol, medication safety, electrosurgical safety, positioning, surgical counting and documentation, specimen handling, equipment and devices, and ensures latex safe environment. And her focus on infection prevention, she ensures that she creates an aseptic technique and maintains a sterile field, ensures proper traffic patterns in the operating room, surgical attire is used according to how it is required, according to specified protocols. She ensures there's adequate instrument processing and disinfection, the sterilization, and there's scrubbing, gowning, and gloving. Her focus on anesthesia and analgesia, she basically acts as an anesthetic nurse, and she assists in these procedures: general anesthesia, spinal anesthesia, regional, and she's also able to assist in the management of complications of anesthesia, like malignant hyperthermia and she also provides pneumothermia during the surgical procedure. And her focus on ethical and legal considerations. Informed consent is the vital document. She has to ensure the patient has an informed consent before surgical intervention. Perioperative nurse basically is a patient's advocate. So how is she a patient's advocate? Usually the periop nurse takes care of the patients who are under sedation or who are under general anesthesia and who cannot talk for themselves. When they are under anesthesia, they cannot even complain of anything. So usually the nurse is supposed to act as the patient's advocate, and the perioperative nurse is the voice of the patient during surgical intervention. So the perioperative nurse is a perioperative nurse is supposed to be knowledgeable on aseptic technique. The perioperative nurse is supposed to be knowledgeable on patient safety, on the legal aspects of nursing. The nurse should be able to manage nursing activities associated with specific surgical procedures that are being performed. Operating room nursing is unique. What is patient safety? Patient safety is defined as avoiding harm to patients from care that is intended to help them. So while you're giving care, we have to ensure that the outcome is positive. We do not add any other aspects to the patient that the patient is not supposed to. The patient came in to get assistance, the patient should have a positive outcome when leaving the operating room. So avoiding harm to the patient during your care is very vital. And this involves prevention and mitigation of the same harm this harm can be caused by errors of omission or commission during the practice. So how do we mitigate this? Is to establish operational systems and processes that minimize the likelihood of errors, and also maximize the likelihood of intercepting these errors when they occur, and even we intercept before they occur. So what are the common errors that occur during the perioperative period? So a brief introduction, clinical error. This one is defined as any error in conduct or judgment in the clinical environment, irrespective of whether or not the error produces or is the main cause of adverse events. Usually it is said that at least 50% of clinical error can be avoided. So errors, they're also known as the never events. That means they should never ever occur during practice. Over time, the list has expanded to describe adverse events. And these events, they are clearly identifiable and measurable. And usually they result to the death of the patient or disability. All these errors and the never events, it is said they are usually preventable. There are things and aspects that we as healthcare personnel can prevent. Therefore, perioperative nurses, they play a key role in the prevention of the never events. And what are these never events? Some of these never events that I've put, there may be more than what I've put here, but I have mentioned a few. Surgery can be performed in the wrong part of the body. Surgery may be performed on the wrong patient, or it can be performed on the right patient, but it's wrong surgery. Wrong surgery on the right patient. We could also have unintended retention of foreign objects in a patient after surgery or procedure. We could have death on the table, death of a patient. We could have fire occurring, and this can happen during cautery and when operating on the airway. Okay. You could have the patient death or disability, which could be associated with a fall. How do we mitigate these errors? Some of the mitigation are, we have 2 documents in place to mitigate these errors. One, we have the pre-operative checklist, which I will share with you and take you briefly through. 2 is the World Health Organization Surgical Safety Checklist that came about that was brought about due to the number of errors that occur worldwide. Secondly, we could have mitigation depending to the institution and individuals. So we have one mitigation, we have professional organizations. So we have continuous professional CMEs, continuous professional development, and you realize this one is mandatory with nursing, because before even you renew your license, you have to declare your CPD points. And this is very important. Create a positive rapport with patients, especially on the wrong surgery. Involve your patients in site marking the area of surgery. When you involve the patient, if the patient is conscious, if anything is supposed to, when handing over the patient in receiving area, during when the nurse asks about the site of surgery, the patient can be also be able to contribute. Have proper documentation. Very important. Have preventive measures to injuries. In most aspects, you need to have, if in bed rails as an example. Proper reporting of injuries, reports, and effective communication among team members, the surgical team, effective communication among the surgical team and the ward team. It is important for us to relate to be able to have a positive outcome. Competent patient care is the best way in order to avoid malpractice and negligence claims. So as a nurse, you should know your landmarks. What do I mean by landmarks? You need to know your roles and responsibilities, and you need to know your scope of practice. Very important. How far can you go during your day-to-day activities? Have knowledge on the medical legal issues. What can take you to court? And the last one, we have discussed continuous professional development. Yes, another way of mitigating errors, we have the WHO Surgical Safety Checklist. This one is mainly used during the inter-operative phase. So we have the signing. We start with the signing. When the patient is on the table, before the induction of anesthesia, we need to confirm the patient's identity when the patient has not been put to sleep. So the patient can also contribute to the discussion. First, before confirming, the surgical team needs to introduce themselves, because in some institutions, they are meeting for the first time. So one, patient identity has to be confirmed. You need to identify the patient. In identifying the patient has to be identified in 3 names and identified with a unique number, inpatient number or whatever number that has been assigned to the patient. Identify the site of surgery. Confirm, okay, as a team, the whole team, okay? Let me correct myself. This patient has already been wheeled on the operating table and the team members are about to start. So just before the patient is put to sleep, it is when we handle the surgical safety checklist. And this is the first part, signing. So check if the site has been marked or whether it is not applicable. Inquire if the anesthesia safety check has been done, that is the machine, whether it has been checked for the day and it is functional. Check on the pulse oximeter, whether it's functioning on the patient. Inquire with the patient if there's any non-allergy. Inquire if there's any probability of a difficult airway or special risk. And this one, usually the anesthetist will be aware of that, on any risk of blood loss and what amount, and this is documented. As you see, the surgical safety checklist, all this has been done, but this is just a confirmation. You realize during receiving area that the receiving area nurse also checked some of these aspects, but still we are repeating again to ensure that everything is okay. Because sometimes when something is missed out in the receiving area, it looks at times that it will be missed out throughout up till the end of the surgery. The second part, we have timeout. Here the team takes a pause and confirms this. Confirm if all team members have introduced themselves, to confirm again by name and role what they're expected to do during what is their role during this surgical process. That is the surgeon, the anesthesia, and the nurse, okay? They all have to confirm again the patient, the site, and the procedure. And what are the critical events that they're anticipating during the surgery? They need to verbalize unexpected occurrences or about airway, about blood loss and all that. And they also to confirm if antibiotic prophylaxis has been given to the patient. Finally, before the patient leaves the OR, we need to actually sign out, okay? The nurse also confirms to the team the name of the procedure that was done, the instrument swab and needle count, whether they're correct, okay? If there's any specimen and if the specimen has been handled as per procedure, and if there are any concerns, it will be verbalized by the surgeon, concerns by anesthetist, or any concerns by the nurse. Apart from this document, there's another document which is called the checklist. The checklist is also a very important document for safety, and this is usually counter-checked by the receiving area nurse. It has been projected there. It has a number of aspects, but because of time, it has 3 aspects. And it is very important for this preoperative checklist to be filled. Usually it has the aspect for the nurse and the area for the anesthetist and the ward doctor. So once the patient arrives in the receiving area, This is the checklist that the receiving area nurse uses to counter-check all the required preparation of the patient. So let me just go through the nurse check, because we're discussing the perioperative nurse. So ideally, before this patient comes to theater for surgery, the anesthetist needs to have visited this patient the previous day and taken his history, done his assessment, and documented this, okay? And he'll also request from them some blood works, which will have to be documented in this checklist. You can see on the right-hand corner, it's written anesthetist. In the middle column is the word doctor check, and this is a check. So the doctor will also do his own assessment on the patient and document on the same. So here on the nurse check, the nurse will also do her part of assessment of the patient during preparation, and she'll document on the same. So when this patient arrives in the OR, the receiving area nurse will counter check whether all this that has been documented has been done, and everything has been done. And this should also, some of these aspects she'll be able to confirm with the patient, like starving, okay, site marking. In identification, the patient needs to have identification bracelet affixed to the wrist or ankle, and this is very important. And this one will mitigate the aspect of wrong surgery, wrong site, wrong patient. You need actually to also counter-check the site, whether it is marked. And if it is not marked, you have to confirm or do not receive the patient until you're sure that the site, the area that is intended for surgery is marked and it is confirmed. Then there's the jewelry, wigs, contact lenses, prosthesis, dentures. She has to confirm that the patient has removed dentures. And this is important because these dentures may follow up during intubation. Clothing, because most of the times patients who come to theater are not supposed to have clothing on them. Whether if a bowel has been prepared on request of the surgeon, if they need any NG tube, whether the NG tube has been inserted and what size, if the blood products are available, if it's blood, how many units, and this should tally with what is requested in the file, the number of blood units that are required. You can inquire on the patient with the patient whether there is any pre-op teaching done. Makeup should be removed. Nail polish and artificial nails should also be removed. While all these procedures are being done, the perioperative nurse should know the rationale of why are we removing nail polish? Why do we need to remove makeup? Because sometimes you find the patients have come with beautiful nails and you want to remove the paint from the nails. So why? Because you need also to explain to the patient, why are you removing her nail polish? You need even to know why all this practice you're doing here, it should be evidence-based. Okay? Vital signs, whether they have been taken and how are the vital signs, and if there's any anomaly, you need to discuss with the anesthetist. The patient needs to have a gown. In some patients, catheter, they need to be catheterized depending on the type of surgery. Medications to the OR, okay, anti-embolic stockings, and if the patient who requires ICU bed, it should be confirmed whether ICU bed is available to avoid inconveniencing the patient, because sometimes you find the patient is wheeled to the OR, then at the receiving area, it's when you realize there's no ICU bed. All this should have been done prior, and this causes anxiety to the patient. Nil per oral, that is starving, okay. Confirm whether the patient has starved, whether it is with solids or clear fluids. Confirm if the radiological films that are required are availed, and this is very important. They assist in the smooth running of the surgery. Consent is a legal document. Ensure that the consent that it has only been signed. Confirm with the patient whether he or she has been explained the pros and cons of surgery, whether she has willingly signed the consent, because at times you receive the patient and the patient starts crying, or in the receiving area, the patient decides to refuse the surgery. Okay, implants, if the implants is required, are they there? Are they available? So as to avoid inconveniences. So this document, you can see, certified, it should be signed by the ward nurse, signature, date, and time. Then again, it should be signed by the nurse who has received the patient. Name, signature, date, and time. And with that, I come to the end of my presentation.
Well, thank you so much, Maria. That was an excellent presentation. Thank you for taking us through nursing practices in perioperative care. We now understand who the perioperative nurse is, and her role has come out clearly. Thank you so much for that. You have also broken down the perioperative care into 3 phases, that is perioperative care, intraoperative, and postoperative care. And in all the phases, we can clearly understand and see the role that the perioperative nurse plays. Thank you so much that you have also understood the common errors in perioperative practice, and we take home the message that I have said, that errors are an ever event. We appreciate that. And then thank you so much for coming up with mitigation measures on perioperative errors. We also take home that all the patients should have name tags on, and they must be identified with 3 names. And this one will help us to avoid errors that occur. You have also emphasized that we should ensure that the patient's files are well updated. That is, we're in the ward and we're bringing them to theater, and also as they're coming from theater. And then we ensure that all documentations required are up to date. Another point that you have really emphasized, and it's of very importance, is the padding of the areas that are at risk of pressure injuries. That's a point we must take home, and especially at this era where we want to reduce completely on the pressure injury areas. Now, looking at the chat box, a lot of compliments are coming up. I might not read all of them. However, Boniface Otemo, thank you. He says it was a very important topic and should be taken seriously. Lilian Mutia has also said it's a nice presentation. We have Galaxy A71 says it was a very enriching presentation. We also have Charles Baraza says a good presentation, Mariam. Essie Branis says the presentation was informative. We have so many, I might not read all. Isaac Somaita also says a good presentation, Mariam. David too says so. There are so many, I will not read all of them. However, there is a question to you, Mariam. Someone is asking, which institutions in Kenya train perioperative nurses and for how long? Probably you could respond to that first.
Thank you very much for that question. We have several institutions that train perioperative nursing, and it requires this training for you to be able to become a perioperative competent nurse. KNH, in the KNH hospital, we have the KNH School of Nursing. We also have the MTRH, we have KMTC, Nairobi Women, Nairobi Hospital, Mata Hospital, and Kijabe Hospital. The course takes 1 year.
Okay.
The course takes 1 year,
Thank you.
52 weeks.
Okay. Course takes 1 year. Someone else is asking, when is the next intake in KNH School of Nursing Perioperative class?
Our intake is usually September. So our next intake is this year, September. But you can apply early enough because we have the process of selection. Yeah. And if you need more information, you can log into the KNH website.
Exactly. Thank you. So members, log to KNH website for more information. More compliments are still coming on. It was a good presentation. We can see, I might not read all of them. However, we are noting them. There are a few concerns. One of them, probably this one, I'll direct them to our CPD coordinators. And for the nurses asking for the CPD points, for example, Modesta, a nurse working in Siaya, says that she has never received any CPD points. And therefore, for our nurses, our contact person or our CPD coordinator is called Jemima Wanjiro. Jemima Wanjiro works in KNH in Nursing Standard Office. The office is located in the 6th floor of the tower block. That is between 6A and 6B. So anytime you may come in, these points have been coming in form of emails. So probably you could also check your emails. But if you don't have, you can always come and see her. There are also Francis Ndwiga et al. They are also concerned about PPB CPD point. Together with Duncan Odero, they say that from January, they have not received any of the CPD points despite having attended all the presentations. And therefore, at this point, I would wish to activate one of our coordinators, Jemima Wanjiro, the nurse coordinator for the CPD point. Probably she would tell us who are the coordinators for the PPB points. Please, Jemima, come on board. Help us understand this.
Good afternoon, everyone. Thank you for your continued support in this CPD points inquiry. Thank you for attending our CMEs. For the pharmacy and poison board, kindly contact the CPD coordinator for CPD at the website CPD at pharmacy, cpdknhpharmacy@gmail.com. Thank you.
Thank you so much, Jemima. On our screen, we can see the link to our PPB and also KMPBC, and also for the nurses. Till be there. There is one more question coming. I think, Miriam, you respond to this one. Somebody, Alan Kochi says about the WHO surgical safety checklist. Comment about its proper administration stroke use. I have seen some hospitals where the checklists are pre-filled and filed. Please respond.
Thank you very much for that question. That document, that document is supposed to assist us and to also mitigate whatever have the errors that we have. And this goes back to us as members of the health team. Do we have integrity? Integrity is the aspect. Do we have self-discipline? And these are the things we are not taught in school. Integrity, self-discipline. Why are we filling this checklist? What is our objective? Okay. So when you take a checklist and pre-fill, does it assist you or your team members? How does it help you? So basically it goes down to the team members. What do you want to achieve? So when you're pre-filling, you are not actually achieving the objective of patient safety. And then this will only become, you realize this when you start having court cases, is when you realize how important this checklist is. Apart from court cases, what is your purpose? You need to have the right outcome for whatever procedure you do. So if you are not going to use what the documents that has been put in place to mitigate such issues, now that is on individual aspect. So basically it goes down to integrity, okay? Integrity and professionalism, and knowledge of medical legal issues.
It's all about integrity and of course self-discipline and understanding why you're pre-filling your list before. Then from Wekesa, very nice presentation, but he says kindly share the slides. Majority of the people, they are saying we share the slides. I also take it back to our CME coordinator. How do we get our slides? She says that you visit KNH website, then click on the button on webinars, and you'll get all the presentations that have occurred. Again, still from Wekesa says that he would wish to attend all the presentation and he wants to know the list or when is the next CME. The next one, I stand guided by my colleagues here. The next one is on Wednesday, that is on 13th April. And the presentations will be still at the same time, 2 p.m. to 3:30. That's on patient-centered care, respectful maternal care series. So don't forget to log in, and there's another one on Thursday. Unless there are any other concerns, I wish we can now conclude on our presentation for today. And thank you, we appreciate. Somebody is saying to the panelists, good work. Thank you so much. If there is no any other question or concern, we may now leave at our own leisure. Thank you so much for being with us.